Hello class, in this brief video I am going to review with you Module 4 Health Illness Belief Assessment. This assignment is due at the end of week 4 and it can be actually started at any time during this class, but it is due at the end of week 4. If you do go to Module 4, you will notice that in the instructions there's an instruction page and a tool. And we will be going through both of these to help you understand the purpose and the reason for this tool. So the first one is the actual instructions. And what you are going to do is find someone to interview. This person could be a patient in a clinical setting. I would ask for permission from your instructor or your nurse manager if you could interview that person and let the person know you are interviewing, that you might be taking notes during the session. Or it could be a friend. It could be, it really should not be a spouse, and it should definitely not be a classmate. And the reason you do not want to do a classmate is because there could be a concern with your Turnitin score. So you don't want to lose points because you've interviewed a classmate. But a relative, you could use one of your own instructors in your nursing school, possibly in a church setting, anyone you can find that has a different cultural or religious background than you do. And the purpose of the tool is for you to talk to that person, and then you will be writing down their beliefs. And you'll see in the tool there's a second column to write down your beliefs, and then there's a third column to compare and contrast the differences or the similarities between the two. So the first and probably one of the hardest parts of this assignment is to find someone. So I would suggest looking early so that you're not waiting until the last minute to find someone to interview. You will be using the document, the tool, which is a table, and I'll bring that up in a few minutes to fill out the form. And you will go through each one of the criteria. So the first criteria you look at, you will identify the patient's age, gender, cultural background, religious affiliation. And then in the second column, you will compare that to yourself. So before I get too far, let me see if I can bring up that tool so that you can see what I'm talking about, and then we can go back to the directions. So here is what the table looks like. So, and I can stay on this tool now, so then we'll follow along in this way. So here's your patient's information, your information, and a comparison. And you're going to go down the tool and interview the patient and answer these questions, and make sure that you see that there's several questions in each category. So make sure you are answering all of them, because that will meet the criteria, and that is across the board. Then you have to put your information for yourself and then do an analysis. This one looks at the perception of personal level of health and wellness, and then what is your perception, and compare the two. This one looks at what is a patient's beliefs with regard to hereditary issues. Someone might think that hereditary plays nothing into their wellness. Another person may say, yes, it does. So again, collect that information as you are working through this tool. Another criteria is what would trigger a visit to the healthcare provider. What type of healthcare provider would they seek? When would they visit a healthcare provider? And what's really important here is this says what level of pain would trigger a visit. So make sure you do that for your person you're interviewing and for yourself. This one looks at mental illness. Again, answer all these questions. This one looks at food and nutrition. This one looks at barriers, and again, that they perceive in their own healthcare, and then what you perceive in your own healthcare, and then compare and contrast. And then you have an area here that you need to look at how might this knowledge of this patient's belief impact the plan of care for this patient. So you're first of all, you're looking at the patient itself and their plan of care. And then the second question asks you to look at what you would expect to see in your overall nursing practice. Down here, you would include your 2 references using correct APA format. So that's basically what you do. This has to be put in a Word document. Remember, once you submit your tool, make sure that it comes out in a Word doc, that it's the proper format. Please do not submit an empty paper. Always check your assignments before you submit it, because if we don't find it till Monday or Tuesday, you would fall under the late policy. If you have any questions about this assignment, please let your instructor know. I do think you'll find this is a really good assignment to just make you aware of different cultural backgrounds, religious backgrounds, and your own thoughts and feelings, and how you will deal with these in your nursing practice.